So after your pet goes home, after having surgery, activity restriction is one of the most important things that you're going to do with your pet. After the pet has had surgery to relieve the spinal cord compression, it's not quite as important for them to be in a cage only all the time. That spinal cord has been decompressed. However, to get to the spinal cord compression and to the disc material, the surgeon had to remove a small piece of bone out of the spine. So that tiny little window that they made, we need that area to be able to build up some good scar tissue for it and have that to form and to be safe before your pet goes back to normal activity. So what that means is at home, your pet should be in a crate or a safe area anytime they're not under direct supervision. That may be even when you go out to get the mail, when you take a shower, if you go to the next room. If you are not directly watching your pet, they should be in a safe area. If your pet is used to a crate, that is where your pet should be. If your pet is not used to a crate and is stressed if we try to put them in a crate, the best thing we can do in that situation is to create a safe area. That can be a small room, maybe a bathroom, maybe a hallway, somewhere that there is no furniture, nothing to jump on or off of, and there's no other pets for them to play with. They also should not be doing stairs at all during this time. Activity restriction is very important. That's going to allow your pet to heal. However, when they are under direct supervision, they can be out with you in a small area. In that small area, I do recommend that if your pet is a dog that will run to the door if they hear the doorbell, or maybe a little bit too active, that you put a harness or leash on your pet so that if the doorbell rings, they don't have much space and they can't get away from you. These little guys can move pretty fast even without the use of their back legs. So we want to make sure that we do what we can to keep them safe. So when they're under your direct supervision, it is okay for your pet to pull themselves using their front limbs and to start trying to use their back limbs. Sometimes that looks a little bit scary, but as long as they're in a very small, confined area with you, that is okay. They should not be pulling themselves around or be active for more than 5 to 7 minutes at a time. If they're going to lay down and rest next to you, that is okay. So the next thing we're going to talk about is recumbent care. As far as recumbent care, that means when they're in their safe area, whether that be their crate or their small room or small hallway, we need to make sure that they always have a padded bed or area to sleep on, relax on. We want to watch for pressure sores. Most small dogs, we don't have to worry about that quite as much because they're able to flip themselves, but we do still want to watch on their bony prominences, so that meaning the hips, the knees, the elbows. We want to make sure that we watch for sores or loss of hair or anything like that. So we want to make sure they have a nice padded area. We want to make sure we keep them clean and dry at all times. We do not want them to get urine scald or to have some hygiene problems. We want them to make sure that we keep them clean and dry. And that recumbent area, meaning the area that they're going to lay and sleep, we want them to be clean, dry, and padded. The last thing we're going to go over today is how to put on the walkabout pants. So most of our patients will go home with a sling called a walkabout. It will look like this. We call these pants, and I think that helps a little bit because the reason we call them pants is because there's 2 leg holes and they go over the legs just like pants. So we're going to put these on Chester today. The important thing is the blue side goes towards the pet and there is a cutout for the tail. So we're going to set our walkabout pants down. We're going to gently lift up Chester's rear end, and I'm going to put my hand under his belly to hold him up. We're going to put his feet into the holes, and then we're going to pull this up over his thighs. At this point, if your pet is moving or if your pet is a larger pet that's heavier, it's definitely okay to set your pet down to do the Velcro at this point. So then we're going to do the Velcro and we're going to do the clasp. What this does is this gives you a handle so that you can take your pet outside. This is only to be used when your pet is outside. It can stay on for 30 minutes to 60 minutes. It's very nice and comfortable. If they do get urine or feces on them, you can throw them in the washer, just hang them to dry. And our most important thing is that we don't want to keep these on too long, and we want to make sure that we monitor the pet. So when we're on the floor, and we'll show you more in the next shot, but this allows you to hold up the rear end of your pet. Instead of under their belly, it's going to actually support the pelvis. This allows them to urinate and defecate in the sling, and you don't have to lean down and hold them. It also allows us to get the front end of your pet up in a more normal position. This is going to help them to maintain their front end strength in their front legs, and allows them to feel a little bit more normal. When we're walking the pet on the floor, we want the pet's back to be straight, and we want the pet's legs to be in a normal position. As far as if the pet can move their legs, they have the ability to. They're not too low, but they're also not too high, so their feet can touch the ground.